Good afternoon, everyone, and greetings from the team DTech. Today is a very, very special day, and in the presence of our chief guest, Dr. Mahendra Manchpura, our guest of honor, Dr. Akhtar Hussain, Dr. Shashank Joshi, and our special invitees, Dr. Vasant Kumar, Dr. S.R. Arvind, Dr. Jayesh Lele, and uh, also Dr. Shyam Sundar, who is currently the president of the API, and Dr. Bansi Sabu, the DTech chair as well as the founder, along with all the respected dignitaries and the guests who are present here and those who are watching us live for this telecast. This day is very, very special because it is not just any other conference, not just any other inauguration. This is a concept, this is a new, I think this is a day which is going to create a new milestone in the historical landmark where we are going to talk about the technology. There is not a single aspect of our life which is not being touched upon by technology, and the way it has changed our lives in the last 2 years, especially during the pandemic times when the advancement in the telemedicine has happened, the way we interact with our patients has happened. The technology is going to be one of the very, very important key factors in the management of the chronic diseases and especially the diabetes. So this platform called DTech, and which is organizing the first World Congress of Diabetes Technology. So I welcome you all. And to take it further, I would like to invite none other than our mentor, teacher, guide, Dr. Bansi Sabu, who is also the founder of DTech, to deliver his welcome address. Let me just tell you a few things about Dr. Bansi Sabu. You all know about it, but there is something which is very special. The word impossible does not exist in his dictionary. And whenever you work with him, he will push you to the limits, and he will always think of something which you can never think of. So this is my experience with him, and whatever he feels, he gets it at the end of the day. He is able to get it and achieve it at the end of the day also. So when we thought of this DTech, it was his idea, his brainchild, and he guided us all through this program. So we welcome Dr. Bansi Sabu. A very, very warm welcome to you, sir. And now the stage is yours. Please deliver your welcome.
Thank you, Amit. Thanks for kind words. Respected Chief Guest, Dr. Mahendra Manchpura, Honorable Minister of Government of India. He is a Minister of Ayush. He is Minister of Child and Women Development. He is close friend because we studied together. He has done his MBBS and MD medicine. He was a leading physician from Surendranagar. Unluckily, he could not join, so he sent his video message, but he will be joining soon, probably for a few minutes. I just messaged him. We have with us our guest of honor, Dr. Akhtar Hussain, who is the President-elect of International Diabetic Federation. My very close friend, my elder brother, Dr. Shashank Joshi, who is always there with me, who is the chairman of International Diabetic Federation, Southeast Asia region. Respected President of RSSDI, Dr. Vasant Kumar, President of Association Physician of India, Dr. Shyam Sundar, President of Diabetes India, Dr. S.R. Arvind, and our Secretary of Indian Medical Association, Dr. Jayesh Lele, who are with us today. My very close friend, who is known as technology man of our country, Dr. Jyoti Dev, my dear friend, Dr. Manoj Chawla, all advisory board members of this DTech, all my colleagues of DTechCon organizing committee, all national and international faculty, all the esteemed healthcare professionals, industry partners, startups from India in the audience, I welcome you all. At the outset, I feel privileged to be here in front of you as the founder of DTech. I'm humbled to be able to address this room, who is full of my seniors, colleagues, and friends. It is with immense pleasure that I welcome all of you for the official inaugural ceremony of our first conference of DTech, known as DTechCon, on this wonderful virtual platform, which I hope you all will enjoy. Each session of scientific program has been chosen keeping in mind its clinical relevance as of today. The mission of our DTechCon is to improve diabetes care, mainly increase awareness about technology, uses of technology in our country, as well as in developing countries. We hope with the coming years, our startups who are working in field of diabetes technology will come out with newer technology and which will be more useful for India specific, because they may be more cost effective, and maybe for developing countries they will be more useful too. Our mission is to see that diabetes technology should lead the way the standardized care of diabetes, which should be available even in rural area of our country and in other developing countries. What we have seen, that the uses of technology in rural area, or those who are poor who can't afford, they are not using it. So that our mission is very clear from the diabetes technology, that uses of technology should be across the country. For everyone, it should be available. And our model was to train the primary care physicians, young doctors, even caregivers, and patients themselves too, for improving the diabetes care before they reach even tertiary care center. This technology should help them for better control of diabetes. With the help of our organizing committee executives, which you can see hundreds of executives who are very actively involved in diabetes technology, we are planning to organize multiple diabetes technology awareness activity. So this may be our one of the big activity where we are doing a congress where thousands of doctors are joining. But other than that, we want to do multiple awareness program for public education, as well as for educating other doctors too. Again, for improve the quality of life for people with diabetes. I am very much thankful to Dr. Pratik Chaudhary, who is from UK. I am sure many of those who are working in field of diabetes technology, they know him, who is from Diabetes UK. He is also chair of Diabetes Technology Network of UK, who partnered, who supported our diabetes technology, and also the presidents of ATTD, two organizing chairmen of ATTD, Dr. Moshe and Dr. Thade, for their support and for mentoring us. Whatever the help which we needed, any speaker from any part of the world, they were always there to help us for that. We are open to having more ideas from industry partners, from our seniors, from our colleagues, from our executive committee member, for more suggestion, and we would like to implement their ideas to improve the care for our diabetic patients and to increase the awareness for diabetes technology. I also wish best of luck for next year team. We would like to have the face-to-face diabetes technology meeting. That is our plan. Let us all get together to achieve a common goal for best clinical, technical outcome for our future generation, for our future generations of doctors. With this, I welcome you all the audience who are there on this virtual platform, and thank you very much.
Thank you, Dr. Bansi Sahu, sir, for your to address this August gathering with your welcome address. Now it's time we invoke the Devi Saraswati goddess, and she is the goddess of the wisdom, knowledge. So I will request the RX team to start the lamp lighting ceremony, and I will request all the dignitaries here to join us for the lamp lighting ceremony.
Kurutvang kalyanam arogyam dhanasampadah Shubham kurutvang kalyanam arogyam dhanasampadah Shatru buddhi vinashaya Deepajyotir namostute Deepajyotir namostute Shubham kurutvang kalyanam arogyam dhanasampadah Shubham kurutvang kalyanam arogyam dhanas
team for ceremony. So I invite Dr. Rakesh Parekh. Rakesh Parekh is the program that and he's and last this day happen and to Congress. He also not you, all of you, the diabetes program here and Parekh, uh, more.
Thank you, Dr. Amit. Respected Chief Guest, Honorable Minister Dr. Mahendra Munjpara, guests of honor, respected Dr. Akhtar Hussain sir, Dr. Shashank Joshi sir, Dr. Vasant Kumar sir, Dr. Shyam Sundar sir, Dr. Jayesh Lele sir, Dr. S.R. Arvind sir, and all the other senior dignitaries on the panel. It gives me immense pleasure to present the World Congress of Diabetes Technology, DTechCon, to all of you. Our founder chair, Dr. Bansi Sabu, had the vision of having one conference dedicated to diabetes and technology alone, a conference in which we do not discuss the topics that are routinely covered in other conferences, but design the scientific agenda to include all important technological developments in the field of diabetes and metabolic health happening around the globe. With the help of Dr. Bansi Sabu, we are today honored to have the legendary speakers from all over the world. In addition to the keynote lectures, we have dedicated symposia on various topics like pediatrics, must-have technologies for diabetes clinic, cellular therapies, digitosomes, self-monitoring, comorbidities and complications, futuristic technologies, newer therapies, and therapies of tomorrow. We are having a separate insulin pump school and CGM Academy in the Venus Hall tomorrow. There will be a panel discussion where not just the future prospects of technology, but limitations will also be discussed. We have a separate panel discussion in which the panelists are themselves people living with diabetes, and they will share their own experience in using various technological gadgets. This session will be moderated by a mother of type 1 child who is working in the field of diabetes research for last 12 years. For young researchers, there is a free paper session in which they will present their research work. In addition to the people living with diabetes, the healthcare professionals, the researchers, paramedics, let's not forget two very important stakeholders, the innovative minds who are coming up with startups to make our lives easier, and the investors who invest in such ideas at a very young stage or early stage and mentor the founders to translate those ideas into a product. In DTechCon, we are having panel discussion among a few such investors. We also have a dedicated startup pavilion where 17 startups from various parts of the world will be presenting their work. In fact, the response that we received from startups was beyond our expectation. We had to extend the session from 90 minutes to 180 minutes. We will have to run it in parallel, even with the orations in Mars Hall. Still, we could not accommodate all. I think, as Dr. Bansi said, next year, if we are planning a physical conference, I'll request him that we have a dedicated hall only for startups, because the response is really encouraging and beyond our expectations. To connect people from all over the globe on a virtual platform has limitations of time zone. Still, we did our best to bring you a good scientific program and hoping that you would all like this. This could not have been possible without the painstaking efforts by my friend, Dr. Amit Gupta, and the whole organizing committee. So at the end, I welcome you all again for the World Congress of Diabetes Technology. Thank you, Amit.
Thank you, Dr. Rakesh, for giving a brief about the scientific program and what is coming up in the next 2 days. Now, I would like to call upon Dr. Jyoti Dev Keshwade sir. Dr. Jyoti Dev is the man who is known for pioneering in the field of technology, and he is one of the person we all look up to when it comes to the usage of the diabetes technology. Dr. Jyoti Dev is also now starting an international journal of diabetes technology, and I will request Dr. Jyoti Dev to now please come and talk more about the journal and guide us.
Thank you, Amit. Respected Chief Guest Dr. Mahendra, Honorable Minister, respected Dr. Akhtar Hussain, Dr. Shashank Joshi, Dr. Bansi Sabu, Farida, and many others. First of all, let me congratulate my dear friend and brother, Dr. Bansi Sabu. DTechCon is the brainchild of our visionary leader, Dr. Bansi Sabu. And many congratulations for this initiative. And let me also congratulate the entire team my dear friend Dr. Manoj, Rakesh Pari, who is the chief organizer of this program, and then Dr. Amit, Dr. Bharat, and many others who have joined us today. And if we are discussing the facts, in India, we have close to 80 million subjects with diabetes. And with all the available treatment options for diabetes, according to the research and the evidence, 50 to 90% of our patients are still developing all those expensive, devastating complications of diabetes. And what is the piece which is missing in the puzzle? The solution will be smart technologies to be incorporated, cost-effective technologies to be incorporated in the management of diabetes. And this solution is similar to how we have been using smartphones and how it has brought the revolutionary changes in the lives of humans. And I will say that just by incorporating a glucose meter or preferably a continuous glucose monitoring device, it can bring revolutionary changes, market changes, significant changes in the short-term and long-term outcomes in diabetes. And I know I am very fortunate to represent here as the chief editor of International Journal of Diabetes and Technologies. And we have been listening to Dr. Rakesh, and there are more than 36 startups joining today and tomorrow in DTECON. And there are many evidence-based research happening from India and from the neighboring countries. But we have realized a huge gap in publishing those original research from India. And hundreds of phenomenal innovations in diabetes technologies are originating in India and from neighboring countries. And IJDT is here to fill this gap. So we'll be bringing out a special supplemental issue, and there we'll be publishing all these selected abstracts. Manoj and me, we are selecting the abstracts along with others, and this will be published in the special issue. And we'll be very far, because IJDT, International Journal of Diabetes and Technology, is a peer-reviewed journal published by Walters Kluwer. And we'll be inviting original research in diabetes, not only in technologies, but original research in diabetes from India and from the neighboring world. Our intention is to promote research from India. And our intention is to publish as fast as possible. And as the chief editor, I am very proud and privileged. I am very happy and grateful to the organizers for officially getting incorporated with this conference, DTECON, and I wish DTECON every success. And let us together partner to save many more millions of lives. Thank you very much.
Thank you, Dr. Jyogi Dev. I think it is very important that a journal is coming from India, and that too is for diabetes and technology. And it is a great opportunity for everyone who is going to present their abstracts in this program, because it is, once the scientific committee decides and the accreditation committee reviews the abstract, they are going to be published in the supplement of the International Journal of Diabetes Technology. So it is going to be a great thing. Can I see Dr. Akhtar Hussain here? Now it's time we listen to our guest of honor, Dr. Akhtar Hussain and Dr. Shashank Joshi.
No, Amit, I think first we have to ask the Manoj.
I think yes.
Dr. Manoj first.
Yes. Yes. Sorry, I just jumped the queue. And now I will request Dr. Manoj Chawla to please talk about the future plans of DTEC and the future plans of Diabetes Technology Conference.
Thank you, Amit.
Dr. Manoj Chawla is the man who all know is very tech savvy, and he is working in the field of diabetes technology for more than 15 years. And he is one of the face of India for diabetes and technology. So it will be a pleasure to listen to him and to listen to his future plans regarding the DTEC.
Thank you very much, Amit, and a warm welcome and good afternoon, everyone. Let me wish all the dignitaries here and all my friends, colleagues, seniors, mentors, and dignitaries and special guests who have joined in a very warm welcome to the inauguration of DTECCon. This is an opportunity for us to congratulate everyone involved in the field of technology in diabetes, everyone who has been a spokesperson for improved use of technology and increasing its awareness. I think this is a celebratory day for all of us as we start the first World Congress in Diabetes Technology, the DTechCon, under the auspices of Dr. Bansi Sabu and many of my able colleagues and friends. Let me also start by giving some quotes, I think, which would be reminders for us that today is a time that it's not that we use technology, but we live technology. Which also gets me to another interesting saying that people who smile while they are alone used to be called insane until we invented smartphones and social media. And who knows this better than me when I live with people, myself and all of us around who live on social media and with the smartphones in their hand. So as DTechCon starts this time in the virtual format, our plan ahead is, of course, as Dr. Bansi and many others said, that we go physical next year, wherein we hope to have all the key opinion leaders and the technology leaders from across the world join us physically when we do the next DTechCon in India. We would ensure that every aspect of science being discussed here today in the virtual platform makes it a better experience as we move on in the physical format, especially the workshops that we plan ahead, whether it's for monitoring or for insulin pumps or many other advancements in technology. The hands-on experience that we'll be able to offer as we move ahead is only an experience that we all wait to experience or wait to feel next year. Our plan also is to ensure that many of the technology startups and the tech companies which are in India and many other countries in the world also look at DTechCon as a platform where they can showcase their upcoming technologies in the field of diabetes and give us all an opportunity to understand that better and adapt and adopt these technologies in the years to come. So the vision for DTechCon is to become a reference technology symposium in entire Middle East and the Asian subcontinent, where people look at DTechCon as that pioneering technology congress where the startups are going to be there, the physicians are going to be there, and the entire community, which is involved in the care of taking care of people with diabetes, is looking at this place as a learning and sharing platform for technology and diabetes. So that's the vision that Bansi, Jyoti, Amit, Rakesh, and everybody here involved in this team have for DTechCon, and I'm extremely happy to be a part of this group. Let me say that I want to end my vision that we're sharing for future by saying that the best way to predict the future is to create it. And that's what we announced today, that the future of DTechCon is physical, and we'll have the dates and the venue out very, very soon. Hoping to see many, many more of you join us in person as DTechCon has plans to become the reference technology conference in many parts of the world. So with that, I thank Amit and Rakesh for spearheading this work, and of course, congratulations to Bansi and everyone, and hand it back to take the rest of the inauguration ceremony ahead. Thank you so much, everyone.
Thank you, Dr. Manoj. We are all waiting and eager to hear from you the next date of the DTechCon and the venue, because everybody would be excited to be a part of the physical conference of the diabetes technology. Now, I would like to invite Dr. Shashank Joshi, sir. As we all know, Dr. Shashank Joshi, sir, is a very renowned diabetologist, endocrinologist of India. He is Padam Shri awardee. He was awarded the highest civilian award in 2014, that is the Padam Shri. He is mentor, teacher, and guide to all of us. And currently, he is also the chair of the IDF Southeast Asia. I will request Dr. Shashank Joshi, sir, to bless us with his guest of honor address.
Amit, I think we can invite the guests of honor because Shashank sir probably will be after the guests of honor as per the updated agenda.
We have with us Dr. Shyamsundar.
Yeah.
Yes. So we have with us Dr. Shyamsundar, sir. Dr. Shyamsundar is the president of API, we know, and sir has recently conducted a very amazing conference at Jaipur, and he was the scientific chair of that conference. And I will request Dr. Shyamsundar Agarwal, sir, to please come here to address this gathering with your address.
Dear Dr.
Please change the slide.
Dr. Bansi Sabu.
Yes, sir.
And, this is a great beginning. I think I think this is the first World Congress on Diabetes Technology.
Yes.
And really, I mean, with our 9% population having diabetes, when the more is done is less. So we need such type of programs and with widening our horizons about diabetes. So I'm very happy that such a thing is happening. And as usual, novel ideas from Dr. Bansi Sabu. I wish this program great success. Thank you very much.
Thank you, sir.
Amit, over to you. Sir, I think Dr. Amit has some network issues.
Yes.
So I request Dr. Vasant Kumar, sir, if he's here.
No. Dr. Shashank was there in between. Where here?
Technology still has some problems, sir. We'll have to address that in the next conference. So, Dr. Vasant Kumar, Dr. S.R. Arvind, Dr. Jayesh Lele, if you are here, please address.
Shashank again joining here in between.
Yeah.
Meanwhile, to break the silence, I would just like to say that it has been a great thing which we have heard from Dr. Shyam Sundar, Dr. Jyoti Dev, Dr. Manoj Chawla, and what Dr. Bansi Sabu has just said. And we all for this wonderful meeting and the conference, and the technology is definitely changing the way we are now approaching our patients, and our patients are looking up to us. And now many of our patients, they come already using some kind of technology to take care of their diabetes. So to take the proceedings further, I guess Dr. Shashank sir is...
We can request Dr. Brij Makkar, who is the president-elect.
Yes,
so I think Dr. Vasant Kumar could not join. So can we request Dr. Brij Makkar for a few words? Dr. Makkar is there.
Thank you, Dr. Bansi. It's indeed a great pleasure to be part of this, first World DTechCon. And I think we must all congratulate you for, spearheading this initiative and thinking of technology as an important component of diabetes care in India also, where we are always thinking that, the use of technology is going to be very, very difficult because of cost and multiple reasons. But I'm sure with the more and more education about technology and more availability, use of technology will be helpful in improving diabetes care for all the patients in Indian setting. And I must congratulate you for this, planning this meeting, and also my best wishes. Thank you.
Thank you.
Thank you, Dr. Bakkar sir. Now we would, since some of our guests were keeping busy and they couldn't join because of some of the
Dr.
reasons.
Shashank is there.
So Dr. Shashank sir is there, and I will request Dr. Shashank sir to please bless this August gathering with your words of wisdom, sir.
So greetings on behalf of the International Diabetes Federation. Our chief guest, Dr. Akhtar, our president, our special dignitaries, my friends from API, Professor Shyam Sundar, RSSDI, Dr. Vasant Kumar, Diabetes India, Dr. Arvind, IMA, Dr. Jayesh Lele, and all your, Bansi the Great. You have collected these digitonians. I would call all of you all as digitonians, because we have got digitalized. As I joined early, and then I was doing my digital consultations, and I was doing my virtual consultations. And this has been very ably led by Bansi with the help of, Jyoti Dev, Manoj, Amit, Rakesh, our student from KEM, a very bright guy. I can see many other attractive faces. Bridge is there, and Om Lakhani I can see. So the Digitonians, Dakshata I can see, Sunil M. Jain from Indore I can see. Everybody has joined here. Farida I can see, Purvi I can see. So I can see Bharat. So, this digital, COVID allowed us to get digitally connected. And, currently, India is the second largest country on planet Earth with people living with diabetes. And currently, we are a part of the ICMR India project. Dr. Mohan is our PI, and the PI from our state. We have close to around 18% Indians with diabetes now in urban India. And the only challenge is by 2035, we predict that rural India will overtake urban India in diabetes. And the only way we can connect rural India and urban India is through a digital technology. COVID taught us a mechanism. Now we have to build a digital infrastructure. Today you must have seen the tweet of Honorable Prime Minister that we have broken a world record on e-Sanjeevani, which is our Government of India app. And this is a very proud moment for all Indians that we are doing so well. We should be the digital, India should be the digital capital of the world as far as diabetes care goes. And all of you all are technology savvy, social media savvy. The only challenge is that currently our biggest barriers to patient care is that information overload and clutter is very high. And, social media apps like Google and WhatsApp spread information, which is not necessarily evidence-based. And therefore, first thing I think your technology society should do, Bansi and the group, is that we must ensure that we are able to spread evidence-based filtered information, which is correct, both for people living with diabetes as well as healthcare providers who are taking care of people with diabetes. So I think it's very important to have that filter. And I think the digital mechanism allows you to create that filter. Secondly, I think you should come out with the white paper on applicability of digital care and access and affordable access in rural India, because in rural and remote parts of India, mobile phone penetration is one of the largest in the world, in our population density, and how to use that in a more effective way is the order of the day. And third is, of course, we are all committed that we want to have a diabetes free world or a complication free India, which once a long time back you had propagated. And that's very, very doable. I think it's currently very, very doable, very, very possible. And I think I wish all of you all excellent success. We are here all to listen, to learn, and to adapt. I was a late mover on technology. I didn't know how to use. I didn't have a WhatsApp till probably 4 years back, and I used to use SMS and emails. But now I have got digitalized, and once you have motivated all of us to be digitalized. So as I said, as I talk to you, I've kept a virtual consult on the hold to speak to you, and that's the way to do it. So once you lead the way and get some good quality work. Jyoti Dev, again, congratulate you. You are doing some astonishing work. I know that Dr. Jyoti Dev Kesavdev at 2 o'clock at midnight is consulting people in Muscat, in Dubai, in California. Where have you? And that's the true way to do technology. And next day you will see Purvi is doing an interview of Jyoti Dev and transmitting it in Spain, where Manoj is sitting. So all this is possible now. So all this is now a reality. So I think we are in a virtual world and a digital village. And I congratulate all you Digitonians for taking this move forward. Rakesh, your enthusiasm is effusive. So is Amit. You all are the Gen X, and I'm certain that this will go a long way. Remember two things: that ultimately there is always a human behind every technology, and there's always a threat that AI can replace technology, can replace human beings, but that can never occur. We know it from chess. We know it from machine learning, that there has to be human touch to all technology. And I think don't forget the human touch. And again, I congratulate all of you all for this outstanding, meeting. Always keep a hybrid mode, because more people can learn. And even if you do a physical mode meeting, I saw everybody wants to become physical suddenly. I was hearing the beginning part of Rakesh and Manoj. Everybody wants to get physical, but remember that in digital you can reach many more people. Even though we may collect physically, the reach is larger. And don't forget rural India, don't forget remote India, don't forget the underprivileged, have affordable access as the theme. And that's all I would say. Jai Hind.
Thank you, sir. You for your blessings and the words of wisdom. You just gave us a new title. Everyone who is present here, Digitonian, and this is something a new word you just coined for all of us. And we will all look forward to your talk also, sir, that you are going to talk about the use of technology with the human touch. So I am sure it is going to enlighten us on that aspect, because that is very, very important. So I would now request the RX team and welcome our chief guest, Dr. Mahendra Manchpura, who is Minister of State. And he has sent his blessings in the form of video message. I will request the team, RX team, to play his message. Before that, if Bansi sir would like to say anything, because Dr. Mahendra Manchpura is a very close friend of Dr. Bansi Shapu, and he has spoken to him and he has briefed him about this conference and the congregation.
So first, let us listen him, and then we will. It's a very simple man.
Yes.
Mahendra Manchpura. Over to RX Events for his video. Yes.
Namaste. First of all, let me congratulate Dr. Bansi Sabu, Dr. Amit Gupta, and Dr. Rakesh Parikh for organizing this World Congress on Diabetes and Technology. Dr. Bansi is a good friend of mine, and I have closely witnessed his dedication for the welfare of his patients, especially for the children with diabetes. I have also seen him evolving with his organizational and leadership skill. Over last few years, he has organized number of conferences in Gujarat and outside. But this conference has a special importance. We all know that diabetes and its complications are probably the biggest healthcare challenge for all of us. But India is country of innovations. Our young brains are coming up with newer ideas and technologies to beat this challenge, and I am sure many of them would be participating in this World Congress with the galaxy of stars and delegates from all over the world participating in this conference. I am sure this is going to be historic event. I wish Dr. Sabu and his team all the best for grand success of this conference. Jai Hind.
Thank you, Dr. Mahendra Manchpura. Most of us, we know that Dr. Jitendra Singh is a diabetologist and a physician from our community who had become the minister. And many of you may not be knowing Dr. Mahendra Manchpura. He is a physician who was practicing, physician who has passed MD medicine, and he was practicing in a Surendranagar district, which is a very small district, and where he was practicing. Now he is member of parliament from Surendranagar district, and he is the minister. He is minister of state for Ayush ministry, and he is also minister of state for women and child development. I talked to him for 2-3 things more. Like one is our type 1 children program also, for which he was very excited. And in Gujarat already, those who does not know that now in pediatric disease, 31 notified disease. Before that, it was only 30. So now type 1 diabetes, if anyone is diagnosed in Gujarat, up to the age of 25, he can have free insulin access from all government hospitals of Gujarat. So similarly, now we are trying to move the same movement across the country, and probably by this year end, in any part of our country, any child who is type 1 below the age of 25 can have access to the insulin from all across the country, from government hospitals. So that will be available. Secondly, we are also talking to Manchpura this time because Sri Lanka government is not in position to give free insulin supply to their children who are type 1. So again, I talked to him regarding, can we supply the insulin to Sri Lanka government hospital? And they are trying directly government, but some of the organization with the help of IDF Southeast Asia Shashank Joshi, and many more. We talked to the local organization of Sri Lanka, Endocrine Society, Diabetic Society, and we trying to procure insulin from India and to support these children who are not getting insulin now from Sri Lanka government also. So there also Dr. Mahendra Manchpura will definitely help us. But for any other medical thing, otherwise he is primarily not in the health ministry. He is with the Ministry of Ayush. When he got this ministry, was Ayush and the medical, two different fields. But still he is always there for any help for any colleague of us. If you need, anytime him, he will be more than happy. And the next time, whenever we will have a plan, like last time we met our health minister at Delhi, next time, whenever we will be having a plan to visit Delhi, we'll definitely like to meet him also.
Thank you, Bansi sir, and it was really a pleasure to listen to the address of our chief guest. Now, again, a time to give away a few awards, and I will again request Dr. Bansi Sabu to announce these two awards for the first time, which are going to happen in the DTech.
So, I will request Shashank Joshi, our guest of honor, to award two eminent persons from our country. We thought of that we should recognize someone in field of diabetes technology. As we know, there are very few persons in our country who are really working hard in field of diabetes technology. We all know Dr. Jyoti Dev, who is part of diabetes technology, who have started now a journal, who was the one who was going for ATTD meeting before 15 years. Just recently on his Facebook post also, he had shown from 2008 to 2022. Everything is changed except Jyoti Dev. He was same in 2008 to 2000. I think that's the technology what he's using. Then we know the Manoj also. But one very important person, very close friend of mine, Dr. Unni Krishna. And I think this is the time we should felicitate him. He is the one to whom I used to see him as a thyroid man of our country from Kerala. And then he became the CEO of one of the biggest diabetic hospital of our country. Dr. Unni, to read his CV, is an endocrinologist and CEO of Chalaram Institute of Diabetes, in Pune, a leading diabetes institute in India. And it's an IDF center, certified center for education and excellence in field of diabetes. He has clinical care, research, education, and also oversees a philanthropic rural diabetes care program at the institute. He also heads the newly formed Chalaram Diabetes Research Center, which is in the field of innovation in diabetes-related diagnosis and management. He has published multiple papers, multiple orations, award, which he has received. But in field of technology, what I was seeing him since last 3, 4, 5 years, and in his meeting also, a lot of innovation in the meeting and a lot of technology talk were there. He himself is very techno-savvy guy. So I think this is the platform where we should felicitate our close friend, Dr. Unni. And I will request our Dr. Shashank Joshi, who is from Chairman of International Diabetic Federation, Southeast Asia, to felicitate our friend Dr. Unni Krishnan from DTech on this platform. Over to Dr. Shashank Joshi. And then I will request RX Events to have a photograph of Dr. Unni Krishnan. Over to Shashank.
Congratulations, Unni. You have been simply outstanding. Your migration from Amrita, from endocrinology and thyroid to diabetes world has been outstanding, and you have done a lot of seminal cutting-edge work. Continuing growing and keep your missions of research and education apart from clinical care. We are very proud of you. Congratulations once again.
Thank you. Thank you, Shashank.
Now we can have a few words from Dr. Unni Krishnan also.
Yes.
Dr. Unni is here.
Well, it's an honor to receive this award. I thank Dr. Bansi Sabu, all the organizers of the meeting for conferring this award and for the gracious words said about me by all of you. My heart goes to each one of you. And the importance of this meeting is that this is the first technology in diabetes meeting. And as you know, I am a firm believer in technology being able to solve lots of problems of humanity, and particularly in diabetes. I have been a fan of technology all the time, and I've admired all the other people here who also work in technology. My good wishes to the success of this meeting. And once again, I'd like to thank Dr. Banshi Sabu for honoring me, Dr. Shashank Joshi for his kind words, and Dr. Rakesh Parekh, Dr. Amit Gupta. Without mentioning every name, thank you all for the honor. It's very moving. I'm touched and humbled.
Thank you, Unni.
Thank you, sir. Bansi sir can announce the second award.
Yes. Now, second award is to Dr. Om Lakhani, my very close friend, rather I will say my younger brother, from my city of Ahmedabad. We all are proud of him. He's the guy who has developed not only in field of diabetes and diabetes technology or endocrine. He has himself developed some apps in notes in endocrinology. Recently, he had shown me the Centurion insulin app. There are some upcoming apps from him like hypothyroidism in pregnancy, in-hospital hyperglycemia management system. He has developed some websites on his own, endocrinology.co.in, state-of-the-art diabetes electronic medical record system, endocrinology YouTube channel. He is advisor for some of the startup from India like Seven Sugar, Feederfly, Mediva, and he is a chief diabetologist. Is one of the biggest multi-specialty hospital of Ahmedabad, which is Jaidus Hospital, with more than 500 bedded, and he is very, very close to all of us. Most of the young doctors know him very well, and now many seniors also. Recently, before some time, I remember that Dr. Anup Mishra called me for Om also. So now he is known nationally, internationally, everyone knows him. So now again, I request Dr. Shashank Joshi to felicitate young rising star in field of diabetes technology, Dr. Om Lakhani. Dr. Shashank.
Thank you, Bansi. I think Om, congratulations. Dr. Om Lakhani actually needs no introduction. He's prolific in every aspect of life. He's very active on Twitter, Facebook, Instagram, LinkedIn. So his footprint on social media is simply outstanding. But that's not correct. He actually came, beyond endocrinology, has touched every facet of life. Extraordinary human being. I have known him personally. I'm very fond of him, like Bansi, and we're very proud of you. Just like Unni, you are our Gen Next future. Unni is current. I am retired, but Om is the.
Shashank, you cannot be retired yet. Come on.
And Om is really our future of India, because what Manoj was saying, Manoj, Om, Purvi, you all are leading the lights now. And as I said, that as we sit back and enjoy seeing this bright young brigade of India, Om, you really lead that completely. So Amit is here. Rakesh is here, but Om, we are very proud of you, and you are simply outstanding. And Om has some unique qualities, whether it is complex clinical cases, whether it is difficult theory or practice topics, whether it is research, including glycemic management, glycemic protocols. I remember his thesis. I don't know whether he may remember or not, and me questioning him in one of the award functions. He has been simply outstanding, and he has grown. And I'm sure that you have a long way to go. And of course, you are in heart of Ahmedabad there, and you are at the hub. You are brilliant in your innovations. So I'm certain that we look forward to you, just like we look up to me for delivering some outstanding work from this part of the world. So once again, congratulations, and we are very, very proud of you.
Thank you so much, sir. I think, sir, it couldn't have been, the day couldn't have been better for me to, receive this from Dr. Shashank Joshi, sir, and Dr. Banshi Sabu, and to follow the footsteps of quite literally Dr. Inauguration, sir. So I think these are the three people I've looked forward. They are, I would say, my mentors, or people I look up to. I think the day couldn't have been better. That is what I would say. And thank you so much to this team, Dr. Rakesh Parekh, sir, And Dr. Amit Gupta, sir, I think, thank you so much for having me. Dr. Manoj Chawla, so much. Thank you so much. So I think, all I can say is, well, we are right now on the cusp of mixing two things. One is healthcare, another is technology. And I think, these two things have to come together. They started, right? This is the first approach here. And I think, I hope this continues. And to all the young doctors, I think, we need to now, we know how to talk to patients, but we also need to know how to talk to machines, because, they are going to talk back with us. So I think that is what we really need to learn. So I think, a little bit of tinkering and learning in the field of technology is also important for doctors as much as it is for dealing with human beings. So thank you so much for this. Thank you.
Thank you, Dr. Om, and many, many congratulations for the award to Dr. Om and Dr. Unni Krishnan, sir. And now we are almost close to
before we close and before we give the vote of thanks, we have some senior person, like I can see Dr. Sunil Gupta is there, Dr. Sunil Jain is there. So if they want to have a few words, we can invite them. We have from our friend like Farida Madam is there, Girdhar Sai is there from Sanofi. If they also want to have few words, we can have. Then we will have an official vote of thanks. It is okay with you. We have 5. Okay. Sunil, you want?
Yes, we can.
Heartiest congratulations, Bansi Bhai and the whole team. I feel wonderful team, very energetic, always progressive. And I don't say that it's his first meeting. I feel we have experienced during Corona. We had multiple meetings and there was one session on diabetes technology. Maybe the name must be different, but there was one very good meeting last time, and I practically attended each and every session those days in 2021. So we have such meetings going on, and wonderful gesture of recognizing people who are working in this field since many years from this platform can be the brainchild of only one person in this country, and he is none other than Bansi Bhai and the team. And you are trying to make people also understand that we should recognizing people of their different different areas in diabetology, endocrinology, or in medicine in total is, I feel, your cup of tea. Maybe it is whether it is RSSDI, it's celebrating the 50th years of celebration. Maybe it is recognizing past presidents like senior people coming for talking about RSSDI history. So all these newer thought processes are coming from your mind, Bansi Bhai. And we are happy that Shashank, me, we maybe few of our generation, Sunil Mjen, we are really proud of you, and we are always together. And the young generation now need to take over in future. And Amit and Manoj Chawla, many people here are here, Purvi and Supratik or Mithun, Bharat. So and of course Jyoti Dev is always there as our younger brother along. So congratulations to the whole team. Keep doing good work, and we are very happy with it. Thank you very much.
We have from our advisory board member, Dr. Mithun also. Mithun silent since last 1 hour. I mean, we can't see Mithun silent for more than 1 hour. So Mithun, please.
I think technology is going to silence us all. It's a brainchild of Bansi Bhai. I think क्या बोले Bansi Bhai के लिए, तो I think is, no words can be enough with his visionary and mentorship that he's been done. But I personally feel what is going to happen. I learned my diabetes through technology. I feel कि उससे पहले मैं क्या देख रहा था मुझे आज तक समझ में नहीं आया. But once I started using technology, I felt I'm a complete different doctor. And I'm sure with all this D-Technon, hopefully physical, and hopefully with all the workshops, we're going to make a huge impact. And people will come from all over the world to this conference next year in the coming years. This will be the grand success, and that will happen.
Thank you. Dr. Sunil Jain, sir. A technology man from central part of India.
Yeah. Thank you, Dr. Bansi. And it's nearly 2 decades since when we entered into technology. And earlier the diabetes technologies was like initiated in India with insulin pumps, initial learning, and that's what we called technology in diabetes. Then the addition of continuous glucose monitoring came. So diabetes technologies were mainly focused about the glucose monitoring and insulin delivery kind of thing. But in last 4 or 5 years, and particularly in COVID era, we have seen a big change. And now with the smartphone, the technology has gone down to the patient, rural area, and there are many ways now to communicate. So there is a huge scope for this field, and I congratulate Banshi and team to organize this meeting, which is the need of time. And I remember that few years ago, maybe 15, 20 years ago, doctors used to keep themselves away, very conservative, not to go on computers, not to use softwares, not to use technologies. And now we are seeing how the world has changed. So it's a need of time that I understand the youngsters understand they are involved into technology, but still there are many senior consultants. But the technology has become now so user friendly that it's time that we should use this section of so many platforms, web-based technology, CGM, and other technologies, and that's how we can educate our patients and improve their diabetes care. So I hope that this meeting will be a great initiation, beginning, and help to all those who want to learn more on technology. Thank you.
Thank you, sir. Thank you, Sunil. Faridaji, few words from you.
Yes,
How
so
are you seeing that, what are the changes are going to happen in field of diabetes, technology?
Yes, so I think good afternoon, everyone, and thank you for this invitation. And personally, I, as well as our organization, is extremely excited about this, this new conference that is set up and which is only going to focus on technologies and diabetes. So I remember when Dr. Amit Gupta spoke to me, as well as Dr. Bansi Sabu, we said whatever support that is needed, we will kind of provide to you for this endeavor. And our shared vision that each and every one of you all as a practicing physician has, as well as we as an organization have, that to make sure that India becomes a diabetes care capital of the world is going to be achieved through technology. And as Dr. Bansi Sabu was talking about, that how in rural areas we can reach is only through technology. So thank you so much, Dr. Bansi Sabu, Dr. Jyoti Dev, Dr. Shashank Joshi, Dr. Manoj Chawla, and Dr. Amit Gupta, and Dr. Rakesh Parikh, and everybody, all dignitaries on the stage to kind of truly have set up this. And I'm sure that our dream of making India the diabetes care capital of the world is going to be achieved in not so near future. Thank you.
Thank you, madam. Thank you. We have Sai also.
Yes, sir.
Yes,
So proud to be part with all professors eminent. I like the name which Dr. Shashank sir has given, Digitonians. I think it's very apt. So two exploration is happening very clearly. One is the metaverse and the 5G, which is going to change the next level, for sure. And there is another data which says that today India consumes the data which is equivalent to all top 15 countries, would do so. So that means very clearly, we are advancing significantly. When we see from the healthcare professional point, earlier we used to term as key opinion leader, and today it has been changed to a digital opinion leader. So there is a new terminology which is getting worked out called DOL, DOL, and where all the metrics, all the ratings has been done silently behind you. And maybe only me and Farida will know from a pharmaceutical standpoint of view that how much research going on who's there in social media, who's leading the show, who's influencing, and in all set of things. But especially here, I remember for ATTD, only very few go from here, and I always wonder why we have to travel for a advanced technology. Why in reverse cannot happen? Possibly Dr. Bansi has first time thought about that. And sooner or later, we will see more number of international faculty attending the ATTD of India, which is going to be, the realistic dream. Thank you, sir, being a part, and very happy to be part of it.
Sir, I would just like to share that.
Within 2 years, we'll see this happen. Within few years, before 2025 only, you will see this happen.
I would just like to share one information with all the dignitaries here. that we have more than 1,500 doctors who have registered from the other countries for this function. So this is again.
What Sai was saying that instead of going in HTTD, people should come from there. So at least we may not get from the European delegates, but I am sure next year only we will get a lot of South Asians and many of our delegates coming to us.
While Sai is here, we can take the first promise from him that the next big study from Sanofi will be released at DTechCon 2023 or 24 and not at ATTD to begin with.
I will definitely try. I can tell you that much I can tell. He will definitely try it from head office. Now, Amit, we can request for vote of thanks. Over to
so I will so before I invite Dr. Bharat Sabu, I would just request all of you. So today, one of the key words which we have taken away from Dr. Shashank sir, and that is Digitonian. I think it should be the trending on Twitter today for the DTech, and every one of us should write Digitonian and digital
doll.
Amit,
doll. I thought doll was a good word that Sai gave us.
So today we are going to make these two words trending on the Twitter from the DTech. We will be tweeting very soon about these, and all of you are requested to follow up with that. Now I request my very dear friend Dr. Bharat Sabu, who is again a very young person, very talented leader, and I will request him to give the vote of thanks for this inaugural ceremony.
Thank you, Amit sir. A warm good afternoon to everyone. It's an honor to present the vote of thanks for this August gathering, actually. We are fortunate and thankful to have the presence of Dr. Mahendra Manjapura, who is Honorable Minister of State for Ayush, Women and Child Development. Respected Dr. Akhtar Hussain, President-elect, IDF. Respected Dr. Shashank Joshi, sir, who is Chairman, IDF Southeast Asia. Respected Dr. Shyam Sundar Agarwal, who is President, API. Respected Dr. Vasant Kumar, sir, President, RSSDI. Dr. Jayesh Lele, who is Secretary, IMA. And Dr. S.R. Arvind, sir, who is President, Diabetes India. Also, many congratulations and thanks to the award winners, special guests, and the keynote speakers, under whose guidance the DTechCon is going to have a unique identity in the annual calendar of diabetes management, I am sure, across the world, and would be a sought-after event next year. The organizing team of DTech would like to thank the most important set of people, which are the organizers themselves. My respected elder brother, Dr. Bansi Sabu, who is a founder chair, my dear friend, Dr. Amit Gupta, who is organizing chair, Dr. Rakesh Parikh, who is program chair, and respected Dr. Jyoti Dev, sir, who is the chief advisor for this event. The advisory committee also deserves a special mention for enabling the smooth conduct of the program. Respected Dr. Brij Makkar, sir, Dr. Sanjay Agrawal, sir, Dr. Anuj Maheshwari, Dr. A.G. Unnikrishnan, sir, Dr. Manoj Chawla, sir, Dr. Mithun Bhartiya, respected Dr. Saurabh Mishra, and whole team of organizing committee, which include hundreds of people who are my very dear friends. We are also thankful to Government of India for giving us the Association of Startup India, which is very unique for this conference. And we would also like to thank Diabetes Technology Network UK and ATTD for supporting our endeavor. We are also thankful to the industry partners and startups which are there, without which the event would not have been the glorified one which it is today. And last but not the least, the delegates which make any event a successful one in terms of dissemination of science. We would like to thank our mammoth thousands of delegates, more than 1,500 international delegates, for registering for this wonderful event. As the scientific coordinator of this esteemed program, I would like to conclude this inauguration program by just reciting a simple quote from legendary Steve Jobs, who says that let's go invent tomorrow instead of worrying about what has happened yesterday. And may we be able to do it. Thank you.
Thank you, Bharat. Now I would end this inaugural ceremony and we will start the proceedings in the hall.
We will have our national anthem. We will have national anthem from RX events.
Yes.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे